Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us again. Going to have a conversation with Dr. Jennifer McVige this evening, director of the Concussion Center. She's joining us to talk about the difference between a migraine and a bad headache. She's also going to discuss ways that a teenager might subvert a migraine by avoiding certain potential triggers, and also about a new treatment that is worn. Welcome to Health Professional Radio, Dr. Jennifer McVige.
Thank you for having me this evening.
Director of the Concussion Center. Give us a bit of your professional background and talk briefly about your role there at the Concussion Center at the DENT Neurologic Institute there in New York.
Yes, I work in Buffalo, New York, at DENT Neurologic Institute. I am board certified in Pediatric Neurology. I also treat patients who are adults and pediatric patients, as I'm board certified in headache medicine and neuroimaging. And I got interested in this because I am a migraine sufferer myself.
I've heard of migraines my entire life. What is a migraine and what is a bad headache?
That's a great question, and it's an often asked question by my patients. Migraine, the definition of migraine is that there are certain features. So patients may have light or sound sensitivity. They have nausea. Pediatric patients tend to have vomiting more than adult patients. Mm-hmm. Also, it is exemplified by a moderate to severe head pain, as opposed to like a dull, annoying pain. And it is also made worse by physical activity. So patients with migraine often want to sit and go to a dark, quiet room by themselves.
Are they caused by some type of injury, stress, some type of trauma, or do they just come out of nowhere?
We do feel that there's a genetic predisposition. We can actually see that in families. Mm-hmm. I end up treating the child, and then all of a sudden the mom will say, you know, I've had the same thing my whole life. I just never saw anybody for it. And I enjoy doing those visits because I feel like it's more of a holistic treatment. Everybody can start getting on the same page to health and wellness. But we do feel there's a genetic component. Some patients have had some history of trauma, and then it might provoke a post-traumatic headache that converts to a migraine. But again, there's that thought that there's this pre-existing predisposition.
You mentioned pediatric patients. Obviously, an adult can tell you what's going on, light sensitivity, things of that nature. Can a child be misdiagnosed? Are children often misdiagnosed? And if so, are they misdiagnosed more often than adults? Yes.
I do find that I don't know why we feel in society that little people can't have big pain. And oftentimes we, for years, had given them adult medicines in just half the dose, which is totally inappropriate. Mm-hmm. So pediatric patients can have pain that's just as severe as you and I, and they can have migraines. In fact, I have kids down to 3-4 years of age that can really clearly even say that they have head pain and point out all those things associated with migraine. But kids are often misdiagnosed with having sinus headache, unfortunately. And the interesting part is, as a neuroimager, I know that they don't even have frontal sinuses until they hit 16 to 17 years old. So when you point to the front of your head as a kid and say, I have a headache there, it's usually more of a migrainous-induced one with the light sensitivity or sound sensitivity. They get car sick more often, too.
Mm-hmm. Now, I mentioned that you were going to tell us a few ways that teenagers might be able to avoid some of the triggers. We've talked about some of the symptoms. What are some of the triggers? I mean, when I have a headache, I'm pretty sure what the trigger is. Would some of these triggers, be the same triggers for any person, or are they specific for migraine sufferers?
Yeah, so each person may have their own individual triggers, but there are some things that are very common to many patients. So typically, what we see as stress is a huge trigger, especially nowadays. Mm-hmm. Hydration, so being poorly hydrated and having poor sleep, those are the three really big ones. Other ones that are less well known are MSG, or monosodium glutamate. So packets like flavor packets that you put that are processed. Also nitrates, luncheon meat, pepperoni, salami, bacon, and cheese. Can be as well. So eating those and then keeping a diary to see if they actually trigger you or not is really important.
So all of the things that an adolescent would love are, yes, if in a migraine sufferer, are absolute triggers.
Yes. Wow. I always say whatever happens at a kid's birthday party, don't eat it.
Don't eat it.
That's what you know.
What are some of the current treatments, not just for pediatrics and adults, but what about teen treatments?
So, obviously we've been limited for a long period of time with FDA-cleared things for people to take in their pediatric years. But thankfully, there's actually a new treatment that's out called Nerivio. This is, interestingly, not a medication therapy. This is actually a wearable device. It is a neuromodulator, so it helps to kind of neuromodulate the pain response. It's inconspicuous. It's worn underneath your clothing. At the onset of a migraine, patient would put it on, hopefully within the first hour or so of the headache. And they would wear it for about 45 minutes and then take it off afterwards. And the study results were very supportive of migraine freedom and migraine relief in these adolescent patients 12 to 18 years old.
So how is the device, it's worn, how is it controlled? Do you have buttons on it?
It's controlled through an iPhone, or not an iPhone, but a smartphone, any smartphone. And it's been approved for adults for a couple of years now. But now we have the approval for adolescents as well, which is exciting.
Neuromodulation, are we talking electrical shocks?
No, oh my gosh, no. This actually feels almost like a little tingle or a tickle in the place that you wear it. And you know how you used to have kind of those, you would run with like an iPod thing on your arm. It's the same kind of thing. It's just a very small wearable device for a brief period of time, barely noticeable. And then you just take it off and it's over. It doesn't hurt at all. It's just actually a tickling sensation, and you program the device accordingly to your threshold, so what's comfortable for you.
Is this something that is used in lieu of medications, both the medications that a person would take at the onset of a migraine headache and those medications that a person would take, say, maybe on a daily basis to avoid potential migraines? Or is this something that can be used in conjunction with?
So that's right. So the nice thing about a wearable device is that there's no contraindication to taking it with another oral medication. And in fact, it was studied with people using concurrent oral medications. When we talk about medicine, we usually talk about preventative or rescue therapies, not just medicine, but therapy. So preventative therapy would be the thing that you take every day to prevent having a headache, whereas the rescue or acute therapy would be when you have a headache, what do you do?
Are there versions that can be used with a pediatric patient, say someone in second, third grade?
So we're only approved for the device from 12 years old on up. So as far as a third grader, we would have to do other, typically with a third grader, I would do herbal medicines especially, or well-supported oral medications that are documented. And there's only a handful, to be honest with you.
Well, give our listeners a website where we can get some more information about the Concussion Center and about this brand new treatment for migraine.
Yes. So if you're interested in the treatment, it's www.nerivio.com. It's Nerivio. And then my website is, you would just Google DENT Neurologic Institute in Amherst, New York, or Buffalo, New York, and the webpage comes up and everything's there.
I appreciate you joining us here on the program. Lots of great information. Thank you so much.
Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Jennifer McVige, director of the Concussion Center at the DENT Neurological Institute in New York. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.